on Facebook. Seems as though that's happening right now. So I want to say hello and introduce myself. My name is Spencer Culver. I am the advocacy specialist at the Alliance for Healthy Kansas. And this is our 6th weekly town hall that we've done. We're trying to highlight the work that our partners are doing and sharing how Medicaid expansion would affect Kansans in different circumstances and different parts of the state. Today, our town hall is going to focus on mental health. May is Mental Health Month, and we wanted to highlight that by learning more about how mental health providers are helping Kansans during the pandemic. Today, I'm very lucky to be joined by Kyle Kessler. He's the Executive Director of the Association of Community Mental Health Centers of Kansas. Welcome, Kyle.
Thanks, Spencer. Thanks for having us.
Yeah, of course. As we've done with all of our other town halls, if you have questions at any time throughout this process, just put them in the comments below and we'll try and answer those at the end. I thought, Kyle, we could start out by maybe you sharing a little bit more about what community mental health centers are and who they serve for people who might be unaware or unfamiliar.
Okay, and thanks again, Spencer, and thanks to the Alliance for hosting these town halls. And so community mental health centers provide safety net mental health and behavioral health services for people around the state of Kansas. There are 26 licensed community mental health centers, and in line with the Mental Health Reform Act of 1990, they're required to treat anyone regardless of their ability to pay. And so whether you live in Norton County or Wilson County, Sedgwick County, Shawnee County, or anywhere around the state, you have access to community mental health services. And so they provide services to people across the age spectrum and across the income spectrum. So our goal is to provide high quality behavioral health services to anyone in need of them.
That's wonderful. Good to hear. I wonder if you could share a bit more about how the work has changed since the onset of the pandemic and social distancing protocols. What sort of special challenges are you facing right now, and how have you been working to overcome those?
Well, yeah, so we're still all open. I mean, all of the community mental health centers are still open, providing services, especially face-to-face for people who are in crisis. And so family members and people suffering from mental illness should be aware of that. And then the vast amount of services have switched to televideo and telephone services. There's a whole host of services available through community mental health centers in that regard. And if you look at community by community, certainly the Kansas City metro area was hit first. And so we tried to learn what we could out of their experience. And then as Sedgwick County and Coffee County and other places now, Southwest Kansas were hit, we are certainly like any other healthcare provider in terms of the shortage of personal protective equipment, the PPE. So as we're getting up with face masks, now we're really trying to get access to more hand sanitizer and sanitizing materials so that when we do reopen in different communities to the larger public for face-to-face services, that we'll be ready and that they'll feel safe.
That's wonderful. I think that's really helpful context so people can kind of understand what's going on right now. I wanted to talk a little bit about why Medicaid expansion is important for mental health in Kansas to sort of set the stage for our later discussion. So Kansans who need mental health services or services for substance use disorder make up a pretty substantial share of the uninsured who would gain coverage if we expanded Medicaid in Kansas. We know that expanded coverage has a pretty large effect. It both increases the access to those services and the availability of those services to those who need them. This is particularly crucial, I think, in the state, given some capacity issues at our state hospitals at Osawatomie and Larned, and the alarming growth in the use of opioids and other substance use disorder challenges that individuals might be facing. And one of the fortunate things about Kansas being one of the later states to expand Medicaid is that we have a lot of evidence from other states about how expansion has affected mental health and mental health services. And we've seen that it's pretty effective at helping those who need mental health care get access to and receive that care. Cost of services and whether or not people have insurance is a very significant barrier for some folks in seeking mental health care. Unfortunately, the community mental health centers are able to provide services for folks regardless of insurance status, but being able to help more folks get access to insurance would allow them to expand their services a little bit more. I think this pandemic has sort of affected people's mental health in a pretty drastic way, whether it be through social distancing and isolation or resulting financial stress from losing a job or having your hours cut. And Kaiser Family Foundation poll, which is a large national healthcare organization that does a great deal of polling, found that 45% of adults in the United States reported their mental health has been negatively impacted due to worry or stress over the virus. And social isolation and financial stress can be a great cause of worry for folks as they just navigate their day-to-day lives. Even outside of the pandemic, mental health has been a really significant concern for folks in Kansas and for the state legislature. We know from data that suicide has been rising in Kansas, which is incredibly unfortunate. Particularly, it's been hard hitting in our rural and our frontier counties. And we know that increased access to mental health services can provide people with the help that they need to reduce the incidence of suicide in the state of Kansas. Medicaid expansion can play a pretty big role in that by providing help to those who don't have insurance or can't afford mental health care right now. So with that sort of setting the stage for why Medicaid expansion is important generally, and in this particular context that we're in, I want to transition to asking you a few more specific questions about the community mental health centers, Kyle. So can you kind of walk through the type of mental health services that someone can receive at a typical community mental health center across the state of Kansas?
Sure, and they range from relationship counseling or individual counseling for anxiety or depression to more severe illnesses like schizophrenia or bipolar disorder. And again, those are available for kids and adults. And it's not just therapeutic and clinical services, but medical services as well. So if you need to have medication checks or get medication refilled that helps treat those illnesses, then community mental health centers are available to do that as well.
Okay, I think that's wonderful to know. I know that many of your members are very supportive of Medicaid expansion, and from what I laid out, it seems pretty clear from our perspective why they would be. But I wonder if you could share why Medicaid expansion is important from your perspective and from your members' perspective.
Sure, and our association, consisting of the 26 community mental health centers around the state, had unanimous support among our members for passage of Medicaid expansion, and specifically Senate Bill 252, which was the bipartisan compromise legislation. That's something that we feel strongly should be the baseline for what we try and pass in Kansas going forward. One, because of Medicaid expansion, certainly, but also the required connection between the Department of Corrections and sheriffs to get people who are leaving jails or correctional facilities and going back to the community connected with treatment. Many people who are incarcerated suffer from severe mental illness or addiction issues. And so connecting them quickly right when they leave incarceration is key. Third, the Imd Exclusion Requirement, which would basically require the State Department of Health and Environment to submit a waiver to the federal government that would help see inpatient facilities, which are considered institutes for mental disease. So people ages 19 to 64, there can't be reimbursement through Medicaid currently for those ages. And the result is that it has to be all state funded, or they have to figure out a different way to pay for those services. That's something that went back to the 1960s when there was the effort at the federal level to deinstitutionalize and not warehouse people. They didn't want to incentivize inpatient care. What that has done through the decades has led to reinstitutionalization. So people end up being admitted to state mental health hospitals or to emergency rooms at a higher level than they probably need to be in lieu of short-term psychiatric inpatient treatment. So those are the three key reasons that we have called this once in a generation legislation that would help sustain behavioral health finance in Kansas for the long term. And so, sorry, go ahead.
No, I was just agreeing, yes.
So the sustainability of our system is one key part of it. Another part is prevention. Another part is with the pandemic relating to unemployment. But the prevention piece with mental health reform in 1990 and Governor Hayden's mental health task force in 1989, it was chaired by Dave Seaton, who recently passed away and had been a newspaper publisher for years and years and was a strong advocate for mental health in Kansas. They thought that prevention was a very important part of community-based services. And just like our grandparents taught us that an ounce of prevention is worth a pound of cure, it's that way with mental health as well. And so when we see the need for community-based treatment, then the other side of that is trying to connect people with prevention, like mental health first aid or health and pregnancy, things like that. Right now, we have to use any additional county and state funding that we receive for treatment. Whereas if we had payer sources, like through Medicaid expansion, then we would be able to use some of our prevention dollars or some of the additional funding from counties and states for prevention and treating people, teaching people what to look for in psychiatric symptoms or mental illness with themselves or family members. And if I can add on to that just for a second, it was something I thought about very recently when it was being discussed about community crisis centers. And every member of the legislature has lent their voice or their vote at some point to the important model that is the community crisis center, which are also sometimes referred to as community crisis stabilization centers, because they see people, whether you're in the Kansas City metro area, with RSI, Rainbow Services, Inc., ComCare in Wichita, Vallejo in Topeka, Pawnee in Manhattan with Pawnee County, or I'm sorry, Potawatomi County, Riley County, and Geary County. And then there's also one in Salina, Central Kansas Mental Health as well. These are services that people who may be harmed to themselves or others need immediately. And especially with the shortage of state mental health hospital beds that we have, they're even more important services. And a couple of years ago, Kansas was fortunate enough to have two of our own legislators recognized as National Legislators of the Year by the National Council for Behavioral Health because of their work on community crisis centers. And of course, that was Senator Jim Denning, the Senate Majority Leader, and Representative Kathy Wolf Moore, who from Wyandotte County, Senator Denning being from Johnson County. And the same night that they were being recognized for this great work on the treatment side with crisis centers, then also the Born This Way Foundation, which was founded by Lady Gaga, was being recognized for their work on mental health first aid and prevention-oriented services. And so I thought that that was a fantastic tie between treatment and prevention. Plus, I don't know how many opportunities I'll get to talk about Senator Denning and Lady Gaga in the same conversation. He may text me later on and say it happens all the time, but I don't know.
Yeah, I don't think you're getting that opportunity again, unfortunately. But I think, you provided a broader context outside of just Medicaid expansion to kind of talk about the way that Department of Corrections and county sheriffs are involved in this process, and the Imd exclusion and the ability that has to help folks in crisis situations. So thanks for providing that for us. I think that's useful context and analysis. So I kind of wanted to talk a bit about the number of patients that are coming into community mental health centers. Have you seen a big rise in patients because of the pandemic, or maybe not because of, but since it started?
The ebbs and flows associated with the pandemic have been challenging because initially people did not want to leave their homes. So you saw a significant increase in the number of cancellations. And then as soon as folks found out that services or treatment might be available through telehealth, then you saw those numbers go back up. And the number of kept appointments has increased in a lot of places around the state. So people are less likely to cancel when they know, hey, all I need to do is jump on Zoom or FaceTime or the telephone. And so that's been a benefit. And I don't know that we've seen the increase yet. We absolutely anticipate it based on some of the studies that have already come out in the last couple of weeks with people who, comparing where they were in 2018, in April 2018, to where they are now, feeling distress, those numbers are extremely high. In fact, the number is 8 times higher than it was in 2018. And then especially among young people, you mentioned the suicide problem that Kansas has earlier, but that same age group in the 18 to 44 range, they have gone up significantly by 10 times the amount of stress that they are reporting. And so we expect fully to be needed on the front lines as we come out the other side of this pandemic because of the increase in anxiety and depression and even the trauma triggers and potentially PTSD.
Yeah, absolutely. To what extent, how quickly did you transition to telehealth, and do you see that as a more sustainable model going forward in providing care in more rural areas?
Absolutely is the answer to your question. But to be more specific, when we look at, excuse me, like Western Kansas High Plains Mental Health Center, they've been doing a significant amount of telehealth services for years, over a decade, because the rural and frontier area and the amount of drive time or windshield time that therapists or clients or patients would need to put in is so significant. So in a lot of ways, I think we were able to learn, our urban areas in some ways were able to learn from our rural areas as to how these things can work. I think that going forward, this is potentially, my grandfather used to say that the darkest clouds produce the silverest linings. And I think that that's the case with this in some of the things that we'll learn, whether it may be about summer psychosocial programs and having Zoom rooms with kids instead of needing to have them on site. Or it might be telehealth services and the access and success that you can have treating someone through that. So hopefully we won't take steps backwards just because we can, or just because we feel like it's safe. We should continue with what helps the person recover the most.
I think that's great. It's good to kind of, typically we think about urban areas teaching rural areas how things operate, and it's interesting to learn about the way that distance in rural areas is able to help folks in urban areas as well. I think that's a sort of a unique thing. I sort of want to transition now to talking about staffing and workforce as it relates to states around Kansas expanding Medicaid. Colorado's had expanded Medicaid for a while now. Nebraska has passed Medicaid expansion through a ballot initiative, and they're looking to implement in October. Oklahoma is going to expand Medicaid via executive action in the next few months, and it's on the ballot in Missouri in November. So that puts Kansas in this island of states that have expanded Medicaid around us, and us not expanding Medicaid. What impact will that have on your ability to hire staff and retain high quality staff in border communities, do you think?
Well, it's significant. I mean, the more payer sources that you add, the less of your the less of your bottom line you have to feed from other funding sources, or ask the state for more direct funding from the state general fund. So certainly Oklahoma and Missouri have had a head start on this with certified community behavioral health centers, or the CCBHC initiative through the federal government, which Kansas unfortunately chose to pass on about 4 years ago. And then, as you mentioned, Nebraska and Colorado have Medicaid expansion coming right around the corner, or Colorado has it. Nebraska will, and Oklahoma and Missouri are taking steps in that direction. So I think that we need to look at what the fairest and fastest way to provide coverage and treatment to people is. And right now, that's absolutely Medicaid expansion.
Wonderful. I think that's really good to know. So I think, I've kind of reached the end of the questions that I have for you, but I'm seeing a story that was shared in the comments about an individual who lost themselves to suicide. And I wanted to know if someone is watching this right now who themselves is in need of mental health care or knows someone who is. what info can you provide them about where to find their nearest community mental health center to be able to access care?
Sure. If they go to our website at www.acmhck.org, there's a map of the community mental health centers that's available under the drop-down menu. And so that should have contact information with it, or you can just Google community mental health center if you're in Manhattan, community mental health center in Riley County, Kansas. Something like that would take you right to the line, and you should be able to get a hold of a person very quickly.
Okay, I just want to repeat that for folks to make sure they've got it. It's acmhck.org.
That's it.
Okay, just wanted to make sure.
Sure.
So I want folks to be aware that resource is available for them, that they can access care if they need it. It looks like right now we don't have any other questions on the Facebook chat. So I'll give folks a little bit of time to enter in any questions if they have them. But I want to thank you, Kyle, for taking the time to talk about community mental health centers in Kansas, how Medicaid expansion and a number of other issues are of vital importance to community mental health centers, and really important work that you're doing right now to help folks, whether it be through face-to-face counseling or telehealth or conversations over the telephone. That's really great work, and we want to lift that up. So thank you.
I appreciate it, Spencer, and certainly, one other thing I didn't mention earlier, but the unemployment rates, if we're hitting close to 15%, making sure that people have access to insurance coverage, this would be one less thing that they have to worry about down the road. So that's one more thing that's important about Medicaid expansion. And we also know that people, if they have access to coverage, are more likely to access behavioral health treatment when they need it. So when you tie these things together, then it really does make a compelling case, I think, for Kansas to expand its Medicaid program in line with the federal opportunity that's available.
Yeah, I think that's really important to note, that a lot of folks right now are losing their employer-sponsored coverage and maybe don't have any familiarity with navigating the system. So trying to strengthen that safety net so that we don't leave folks out in the dark if they lose their coverage is a really important and compelling reason to expand Medicaid. I want to put in a couple of plugs before we sign off here. So if you haven't already, we're employing a text messaging program to get out important action alerts to folks about key votes on Medicaid expansion, committee hearings, if we're coming to your community or setting up a Zoom conversation in your community. You can get those by texting CANCARE, which is KANCARE to 52886. That's 52886. So you can get those important action alerts, and it also links you up to a program so you can really easily get in touch with your legislators to share your story about why Medicaid expansion would be important to you, how it relates to mental health or any other type of health concern that you're facing. The other thing is we would love for you to be able to get our email updates. Those are a little bit more frequent and contain information like new blog posts or interesting news articles and that kind of thing. And you can get those by going to expandcancare.com, which is expandcancare.com. Okay, it looks like we have a question in the comments from Reverend Peter Lucky. He says, without Medicaid expansion, how do community mental health centers offer professional support for folks in shelters who are struggling with mental illness?
Some of that, thank you for your question, Reverend, and some of that has to do with the arrangement between the shelter and the CMHC. Some of it will occur on site, or sometimes they will arrange for transportation. There is less transportation services available right now because of, again, concerns about passing germs. But I think that in the future that we will go right back to treating those folks how they were treated. But the hope is that they could access telephonic services through the shelter or through another location. but I want to underscore that certainly crisis services are still available at the mental health center. You may just need to ring a buzzer or something like that, but someone should be with you pretty quickly. And if that's not the case, or if there are any concerns about it, people can contact our office and we can try and help them, connect them with services as well.
Wonderful. It's I think good to highlight. Thank you for that. It looks like that's the only question that we've got. So with that, I want to again thank you, Kyle, for coming on the Zoom call and joining us for this town hall. Thanks to Kim for providing ASL interpretation services. And with that, thanks for watching, folks. We will catch you next Wednesday at noon.
Thanks, Spencer. Thanks for hosting. Thanks to the Alliance for the work they're doing.
Thanks, Kyle.